Hi everybody, welcome to Camglish.com online teaching guide. My name is Teacher Angel and let's start our lesson in the Oxford Picture Dictionary. So today, after learning about different medical emergencies, we are going to learn about first aid. What is first aid? First aid is an emergency medical help given to a hurt or sick person while waiting for a doctor. So it's really important that you know something about first aid. Alright, so you see here things you can use, you can put inside your first aid kit. First aid kit. Okay, this is first aid kit. It is a kit containing supplies for administering emergency treatment or injuries, poisoning, or sudden illness. It contains such thing as bandages, antiseptics, and painkillers. Let's name these things one by one. Oh, students, before we discuss this topic further and discuss the things that your first aid kit should contain, let's have a short review of the last terms we had. Okay? We studied. So, please review with me. Let's read together. We had the medical emergency, be hurt or be injured, be unconscious, be in shock, have a heart attack, have an allergic reaction, get an electric shock, get frostbite, burn, drown, swallow poison, overdose on drugs, choke, bleed, can't breathe, fall, or break a bone. It is so important that we keep a first aid kit in our house, just in case we will encounter those kinds of emergencies. Inside the kit is also what we call tweezers. Alright? Then we should have the adhesive bandage. Okay? And then we should have the sterile pad. This is the sterile pad. This pad can be used to wipe germs or dirt or bacteria. And then we have the tape. Again, this is what we call tape. And then we have gauze. This thing here is what we call gauze. It is a thin cotton cloth used to cover a wound. Again, gauze. And then we have in number 7 what we call the first aid manual. Okay? A book that has instructions regarding first aid. And then we have in number 8 the hydrogen peroxide. It is an antiseptic or bleach used to clean wound. That's very important. Next, we have the antibacterial ointment. Okay? And then we also have in number 10 the antihistamine cream, or what we call antihistamine cream. Again, antihistamine cream. It is a cream used to treat allergies to avoid itch. Avoid itch. Alright. Next we have the splint in number 11. This thing here is what we call splint. Splint is a thin piece of wood, metal, or plastic used to support and keep steady a broken bone. That's the use of splint. And then we have the elastic bandage. In number 12, this is the elastic bandage. It is a piece of soft material that covers and protects an injured part of the body. Again, elastic bandage. And then we have the ice pack. Ice pack. Ice pack. And number 14 is what we call the medical emergency bracelet. A medical emergency bracelet. There's the patient's name and, of course, why is he confined in the hospital? What is his sickness? Alright, or illness. And of course, the number of patients in the hospital. Okay? Next. Alright, so now let's talk about the pictures here. We can see different treatments that we can do, or a professional can do, in case of emergency. Like stitches. Okay, in number 15, this is what we call stitches. Okay. And then, in number 16, rescue breathing. Rescue breathing. Alright. And in number 17, we have the CPR, or what we call cardiopulmonary resuscitation. Again, CPR or cardiopulmonary resuscitation. It is the first treatment for a person who has collapsed and has no pulse, okay, and has stopped breathing. It attempts to restore circulation of the blood and prevent death or brain damage due to lack of oxygen. That's the purpose of CPR. Okay. Next we have in number 18 the Heimlich maneuver. Again, Heimlich maneuver. So we call this the Heimlich maneuver. It is a technique used to eject an object such as food from the trachea of a choking person. The technique employs a firm upward thrust just below the rib cage to force air from the lungs. So that is the Heimlich maneuver. Okay, kids, don't forget. Alright? So, remember that people who are properly trained should give stitches or do CPR. Okay, like the doctor. So only professionals can do these things. Okay? So, thank you for joining our class today. I hope you learned a lot, especially about first aid. Okay? And we also studied different techniques on how to save persons' lives. Okay? So, again, my name is Teacher Angel. Goodbye.